Assalamu alaikum and good morning to one and all. Today we'll start with part 4 of analgesic drug. So let's quickly revise what we have studied in part 3 of the analgesic chapter. So in part 3 of the analgesic chapter, we have studied about the symptom of acute toxicity of opioid analgesic. Then we have studied what can be given for the treatment of opioid toxicity. So we have seen the treatment with opioid antagonistic drug like naloxone, nalorphine and naltrexone. So we have studied their pharmacology in detail. Then we have studied about non-steroidal anti-inflammatory drug and their three important mechanisms: how they produces analgesic action, anti-inflammatory action and antipyretic action. In today's lecture, that is part 4 of analgesic drug, we'll study the detailed pharmacology and adverse effect of analgesic. At the end of this e-learning session, you are able to explain common unwanted effect of non-steroidal anti-inflammatory drugs and discuss pharmacology of aspirin and paracetamol. In addition, we'll also see what is salicylism and salicylate poisoning. So let's start with common unwanted effect. So as I have mentioned, the NSAID, in addition to having the analgesic, antipyretic and anti-inflammatory action, the major side effect which is produced by the NSAID, it is on the gastrointestinal tract. So it produces the gastrointestinal disturbance, and this is due to inhibition of COX-1 enzyme. So you remember that NSAID are non-selective in nature. They inhibit basically both COX-1 as well as COX-2 enzyme. But inhibition of the COX-2, it is desirable to produce their analgesic, anti-inflammatory and antipyretic action. Whereas inhibition of the COX-1 enzyme, it is not good and it produces their adverse effect. Let's see how it produces the adverse effect. So remember, the COX-1, it is the enzyme which is responsible for synthesis of the prostaglandin. Actually, both COX-1 and COX-2, they produces the prostaglandin in our body, isn't it? Whereas the COX-1, it produces the prostaglandin which is specially responsible for inhibition of acid secretion in your GIT, and since it inhibits acid secretion and it forms protective layer in GI tract. Now suppose this is the GI tract, this prostaglandin, it is having the mucosal appearance. Since it is mucosal in nature or it having the mucus consistency, it go and form protective layer on GI tract, isn't it? So it form protective layer in the intestine, and since it form protective layer in intestine, the acid which it secreted in the stomach, it doesn't come in direct contact with the acid. And why it is not coming in a contact? Because the prostaglandin, which having the appearance of the mucus, it form protective layer on the intestine, and due to that the acid doesn't come in direct contact with the intestine. So what is happening here? We know that the acid, it is corrosive in nature. If it come in contact directly with the mucous membrane, or if it is coming in contact with the intestine, it produces the damage to the intestine in the form of maybe it produces the injury, it produces the ulcer, or it may lead to the bleeding. Since you are a non-steroidal anti-inflammatory drug, they are non-selective. In addition to your COX-2 enzyme, they also produces the inhibition of the COX-1, which produces the prostaglandin, which is responsible for inhibition of acid secretion and formation of this protective layer, right? Since it inhibits this prostaglandin deficiencies occur in the stomach, and due to prostaglandin deficiency, now there is no inhibition of the acid secretion. Now what is happening? Instead of inhibition of acid secretion, it increases the acid secretion. Also there is no protective layer is formed, so this excess of the acid will come in contact with the GI system, right? And it produces the different effect. Now let's see what different effects are produced by this excess of the acid which is coming in contact with the GI tract. So it produces the side effect, like it produces the dyspepsia, which is also called as the indigestion. So it is the indigestion and it produces the diarrhea, but sometimes it may also produces the constipation. Okay, so the indigestion, the diarrhea, and sometimes in some patient produces the constipation. It also produces the nausea and vomiting. So these are the symptoms you may generally see when you are suffering from hyperacidity. In addition, the severe complication of the contact of your acid with GIT is it produces the GIT injury, and due to injury of the GIT, due to the corrosive action of the acid, it produces the bleeding. And GIT injury, the scientific term for GI injury, it is the ulceration. So whenever there is injury inside the organ or which is present inside the body, whenever injury is there, those injury it is called as ulceration, right? So you call that patient is suffering from the GIT ulcer due to excess secretion of the acid and due to deficiency of the prostaglandin which form the protective layer. Now let's see how we can treat this. So if you know that the patient is suffering from excessive acidity or having the bleeding and suffering from ulceration, in such cases you can administer that patient with prostaglandin analog. So the prostaglandin analog, it is the drug which having the same structure as the prostaglandin, because cyclooxygenase it inhibit prostaglandin which form the protective layer. So you need to give the prostaglandin which can form that protective layer, isn't it? So this example of such prostaglandin analog, it is the misoprostol. It is a very important drug as far as your exam is concerned and also your GPAT point of view. So prostaglandin analog like misoprostol if you give, then this prostaglandin it go and cover your GIT, it form protective layer. Also it inhibits excessive secretion of the acid, and due to that it diminish gastric damage. So you can co-administer the patient on treatment with NSAID with prostaglandin analog in order to diminish gastric damage. So this is how it produces the GIT problem, and you can overcome it by using prostaglandin analog, example misoprostol. This is happen due to inhibition of the COX-1 enzyme. Now what you can do if you don't want this problem to happen, then you can use the drug which are COX-2 selective agent. Means what they does, they doesn't inhibit COX-1 enzyme which is responsible for formation of the prostaglandin which protect your GIT tract. It only inhibit COX-2 enzyme which is responsible for the prostaglandin production which lead to the pain, inflammation and the fever, isn't it? So if you can able to do this, these drugs are called as COX-2 selective agent, and they will produces less gastric damage, and there is no need to give the misoprostol or the prostaglandin analog to diminish the gastric damage. So these are the two solutions to overcome the GIT side effect which are related to non-steroidal anti-inflammatory drug. Now let's see what are the additional problem NSAID produce. So some of the NSAID, they produces the skin reaction. It is not seen in every type of NSAID. It is there with the few NSAID like mefenamic acid and the sulindac. You can see it produces the red skin. So skin become red or red rashes are produced on the skin, and this is not only the symptom, but this is along with urticaria. It is also seen in case of the patient who is on treatment with mefenamic acid and sulindac. In addition, it produces the photosensitivity reaction. Now what is photosensitivity reaction? The drug which produces photosensitivity reaction, if you consume those drugs and if you come in contact with the sun, it produces the skin burn, isn't it? So the skin burn it is produced when you are coming in contact with the sun after taking this medicine. If this type of reaction is seen in the patient who is on treatment with the NSAID, it is called as photosensitivity reaction. So the skin reaction consists of the mild rashes. It produces the urticaria which is characterized by the itching, and it produces the photosensitivity reaction which may be the skin burn or the skin rashes when patient it is coming in contact with the sun rays or the sunlight. So these are second side effect which is related to your non-steroidal anti-inflammatory drug. Now let's see what are the additional side effects. It also produces the renal insufficiency. So the renal insufficiency, it is generally seen at the therapeutic doses of NSAID only in case of susceptible individual. It means renal insufficiency, it is not seen in case of all patients. It is only seen in case of susceptible individual. So let's see what is the reason behind this. It may be due to inhibition of biosynthesis of prostaglandin, which are belong to the PGE2, PGI2 and prostacyclin, because since inhibit cyclooxygen enzyme, all type of prostaglandin are inhibited, whether it are those prostaglandin are beneficial or those prostaglandin they are responsible for the pain sensation, inflammation or the fever, isn't it? So these beneficial prostaglandins are inhibited, and let's see what is the role of these beneficial prostaglandin, especially in case of renal dynamic. So what they does, this prostaglandin, that is PGE2, I2 and prostacyclin, it is involved in the maintenance of the blood dynamics. So the renal blood dynamic, it is maintained by these prostacyclin. So what is renal blood dynamic? So renal blood dynamic, it is the process by which the blood it is supplied to the kidney, isn't it? When blood it is supplied to the kidney, it is properly controlled, means whenever required there is more blood supply, and whenever the excess blood supply is there to the kidney, it is specially controlled by the second mechanism which is called as the compensatory vasodilation. So there is vasodilation, and we know that whenever there is vasodilation, blood pressure it is decreased, and the force by which blood it is supplied to the kidney will also decrease. Because vasoconstriction, what happens? There is more blood pressure. So due to more blood pressure with more force, blood will go to your kidney. So whenever excessive blood supply is there, that is compensated or that is controlled by the prostaglandin called as PGE2. So it increases or it properly maintains blood supply to the kidney. Since this prostaglandin, which is beneficial, which is specially responsible for the compensatory vasodilation and maintenance of the renal blood dynamics, their level it is decreased, sometime the blood supply to kidney will also decrease. And we know that the blood supply play a very important role for maintaining normal functioning of every organ. Like for time being, if there is less blood supply to the heart, it produces the ischemic heart attack. If there is less blood supply to the brain, it produces the necrosis of the brain cell. Likewise, if this blood supply is affected to the kidney, the chronic NSAID consumption due to the chronic decrease in level of this beneficial prostaglandin, it may produces analgesic nephropathy. What is nephropathy? Nephropathy especially it is the disease of the kidney, isn't it? So there will be the damage to the kidney and the kidney become diseased. Why it is happening? This is happen because there is less formation of these beneficial prostaglandin which are responsible for maintenance of the renal blood dynamic and compensatory vasodilation. Due to that, there is less blood supply to the kidney which may produce analgesic nephropathy. So this is very severe, maybe the side effect for the chronic NSAID consumption. So generally the NSAID, it is not advisable for the chronic treatment. So maybe if you are taking it for chronic treatment, then you take ample of water. You must take good amount of the water so that it should be immediately excreted from the body and produces less severe side effects. Other miscellaneous side effects including the bone marrow disturbance. It produces the liver disorder. So liver disorder we will see in a detail, because that is very important in case of overdose of paracetamol. In addition to this, NSAID like the aspirin, it precipitates asthma, especially in case of non-steroidal anti-inflammatory drug sensitive asthmatic patient. So there are some patients who are sensitive to the dose of the aspirin and not seen in case of the all patients. And those patients it produces the asthma, or they produces the complication. So drug must be remembered from NSAID category, which precipitate asthma. It is the aspirin, and it is not seen with all the patient. It is seen only in case of NSAID sensitive asthmatic patient. Now let's see about the aspirin in detail. So today's lecture will study the pharmacology of two drugs, that is aspirin and paracetamol. These are very important NSAID. So the aspirin, as far as its chemistry is concerned, it is acetyl salicylic acid. So again I am reminding those who are preparing for GPAT exam, you must underline this. Chemistry of the aspirin, it is nothing but acetyl salicylic acid. So this is the chemical name of the aspirin. It is commonly consumed drugs, especially the worldwide. It is relatively insoluble. Since this drug it is relatively insoluble, what formulation scientists they did, because if you are giving any drug through oral route, it must be soluble in the water, because it is disintegrated and dissolved in your GI tract, and then only it will absorb into blood circulation. So since it is relatively insoluble, what formulation scientists they did, they have formed their sodium and calcium salt. So when the sodium and calcium salt of aspirin it is formed, this sodium and calcium salt of the aspirin, it is readily soluble in case of the water, right? And you can give the oral treatment with the aspirin. Now interestingly, why aspirin it is widely used? So if you see the aspirin, it is widely used because it's having number of good pharmacological action, or having the good desirable action, and due to that, since it having number of good desirable action, it is also called as wonder drug. So although it is invented as the NSAID, but later on it is observed that the NSAID produce the beneficial action on cardiovascular disorder. It produces the antiplatelet action. So the antiplatelet action you need especially to avoid formation of the blood clot. So in those patients who having tendency to form the blood clot, or who having the thick blood, isn't it? So they are at high risk of formation of the blood clot, which may block your heart arteries and it may lead to the heart attack, isn't it? So to avoid those risks, you can give the antiplatelet drug. So it was observed that aspirin also produces this very good antiplatelet action and can save the patient who are having cardiovascular disorder. Likewise, it is also observed that, and this is based on the evidences, when you give aspirin on regular basis, so the regular use of the aspirin, it is reported to reduce the risk of the cancer, especially of the colon and the rectum, right? So the risk of the colonic and rectum cancer, it is reduced after regular use of the aspirin. So that is another desirable pharmacological action of the aspirin. Then third good action it is seen in case of Alzheimer's disease. There are evidences which show that aspirin reduces the risk and retard the onset of Alzheimer's disease, isn't it? And maybe the mechanism could be because it having antiplatelet action, it may produces the thinning of the blood and it increases the blood supply to the brain. So this might be the action, but again the exact mechanism action of the aspirin in retardation of progress of Alzheimer's disease as well as the cancer, it is not known. It is under trial, and there are many evidences which suggest there are different mechanism of action for their action in case of the cancer as well as Alzheimer's disease. In addition, the aspirin it is very effective in case of radiation induced diarrhea. So you are giving the radiation especially for the treatment of the cancer, and after taking the radiation, patients show the severe diarrhea which may lead to dehydration. So to avoid radiation induced diarrhea, you can also give the aspirin. So these are very important action of the aspirin which are good for the treatment of many diseases including cardiovascular disease, colonic and rectal cancer, Alzheimer's disease and the radiation induced diarrhea. Due to this wide pharmacological action or many good action of the aspirin it is the blessing to the mankind and it is called as a wonder drug. So though it is the wonder drug, but aspirin having some trouble with the pharmacokinetic, and we have seen how it is resolved. So solubility issue was there, so we have formed their salt to solubilize. In addition to that, let's see how aspirin it is absorbed into systemic circulation. So what is the pH of the aspirin? So aspirin, it is acetyl salicylic acid. Basically it is acid, and it is the weak acid in nature, right? So those compound which are weakly acidic in nature, so if they remains in unionized form, so must remember this is very important. If any drug which is remains in unionized form, so those drug will be absorbed into systemic circulation, right? Now when drug remains in unionized form and when drug it is converted into ionized form, so remember that if drug having the pH of the acidic, so the acidic drug in acidic pH, okay, so acidic drug in acidic pH, they remains in unionized form, okay. So they remains in unionized form only in acidic pH. So I am writing the unionized as the UI as the short form. So they remains in unionized form. Whereas if the acidic drug, when they come into the contact with the basic pH, so what will happen? We know that the acid and base, when it combine, there is formation of the salt and water. So what is that? It undergoes the process of ionization. So there is the ionization of that, there is a replacement of some ions, and remember that ionized form drug doesn't absorb into systemic circulation. Now very interestingly, how you are taking aspirin, you are taking it by the oral route. So after oral route, where first it is going, it will go into the stomach. What is the stomach pH of the stomach? The pH of the stomach, it is acidic. Since the pH of stomach it is acidic in nature, aspirin in acidic pH remains in unionized form, and due to that the absorption of the aspirin it is occur from the stomach and not from the small intestine. Very interesting. Why aspirin is absorbed from the stomach? Because it having the acidic pH, it's remaining unionized form in acidic pH, and that's why it's absorbed into the stomach. So this is very important aspect of its absorption. Let's see about the metabolism. So the aspirin it is hydrolyzed by the enzyme called as esterase, right? So it's break down by the enzyme esterase in the plasma and the tissue, and it is converted to the salicylate in the liver. Now this salicylate, it produces the trouble, and we'll see this in their unwanted effect and the symptom of the salicylate poisoning, right? So just now you remember why it's formed, because aspirin it is converted by the in presence of esterase enzyme into the salicylate, especially in the liver and the plasma, right? And this salicylate, it's generally excreted from the urine, because if you see the pH of the urine pH it is basic in nature, right? So since basic pH of the urine is there, salicylate will be not reabsorbed from the tubules, your kidney tubules, and if it is not reabsorbed, it will be excreted from the urine. So the route of excretion it is the urine, because the pH it is alkaline, it remains in ionized form, so it is excreted into the urine. But remember that what it produces the salicylate. So now someone who have taken the high dose of the aspirin, what will happen in such case? The level of salicylate will increase, and in this increase in level of salicylate, it may produces the problem in that patient, isn't it? So let's see the unwanted effect. So unwanted effect, it is generally related to the salicylate. So the salicylate produce the local and systemic toxic effect, isn't it? So let's see what are those effects produced by the salicylate. So the first important problem which salicylate produce, it is called as salicylism. So salicylism, these are group of the symptoms which are seen in case of the patient produces excess level of the salicylate, isn't it? So it is occur with repeated ingestion of the large dose of salicylate like the aspirin. It is syndrome consisting of the tinnitus. What is tinnitus? Tinnitus, it is the high pitched buzzing noise, especially in case of your ear, isn't it? So when there is high pitch buzzing noise which is seen in the ear, it is called as the tinnitus. So this is one of the symptoms. The patient sometimes suffer from the vertigo, decrease in the hearing, and lastly the patient also show the symptom of nausea and vomiting. So high dose of aspirin, it increases the level of the salicylate, and it produces the group of the symptom like tinnitus, vertigo, decrease in hearing, nausea and vomiting. These symptoms are called as salicylism. So these symptoms collectively they are called as salicylism because the reason behind this symptom, it is excessive level of salicylate in your plasma or the blood circulation. So this is one of the problem. In addition, the story doesn't end there. Aspirin also produces the Reye syndrome. So the Reye syndrome, it is not associated with every patient. It is associated with only with few children, not even with all children. So it is a rare disorder seen in case of the children. So when patient take the aspirin, suddenly they start showing the flu-like symptom. What are the flu-like symptoms? Like the runny nose, excessive sneezing, and which is accompanied with some the skin reaction like the skin rashes and the fever. It is called as the Reye syndrome. So what is to be remembered in case of Reye syndrome? It is not seen in all the patient. It is specially seen in case of the children. So this is important part of the aspirin, the Reye syndrome. In addition to that, combination of the liver disorder and encephalopathy, the disease of encephalon, followed by acute viral illness. So it may be not due to the infection with the virus, but it shows the symptom which is similar to the viral illness. It is seen in case of the patient who take the aspirin and those who are sensitive to the aspirin, and especially in case of the children. And it is observed that there is also 20 to 40% of the mortality. So if it shows us this type of symptoms, and sometimes it is very severe and it may lead to 20 to 40% of mortality in the patient. Right? So we have seen about the Reye syndrome, we have also seen about the salicylism. Now let's see in the detail about salicylate poisoning and their mechanism, or how it produces the salicylate poisoning in our body, right? So salicylate poisoning, it causes various metabolic changes, and this is specially depend on the dose, because on the regular therapeutic dose it won't produces this effect. Like if you are suffering from headache, you have taken the Dispirin, right? So the Dispirin one dose for one day doesn't produces this issue. But if you are on chronic treatment with the aspirin and sometime inadvertently you have taken the acute overdose, like you have taken the medicine and the patient has not remembered and have taken the one more dose of the aspirin, right? And this may happen inadvertently. So in such case, there will be the acute overdose of the aspirin, and when the patient take the larger therapeutic dose, then it will alter acid-base balance, and it also produces alteration of electrolyte balance, right? So this alteration of acid-base balance and electrolyte balance, it produces some complication in our body. Let's see what are those complications. So and how this is happen. So the sequence of event which happen with these complications. So let's see that, right? So what happened when during the excess dose with the salicylate? Excess dose of the salicylate, it first produces uncoupled oxidative phosphorylation. So the phosphorylation, it is the normal process of your skeletal muscle metabolism, right? So the skeletal muscle metabolism, phosphorylation, it is a normal process. But now what salicylates are doing, they are not producing just phosphorylation, they produces uncoupled oxidative phosphorylation. Means there is formation of some oxidative free radical, isn't it? So it produces uncoupled oxidative phosphorylation. This lead to increased in oxygen consumption, right? So there is increase in oxygen consumption by the patient. When there is more oxygen consumption, what will happen due to that? Oxygen will be converted into carbon dioxide. So it will produce more carbon dioxide. So more oxygen consumption lead to more production of the carbon dioxide. Now let's see what happened further. Due to more carbon dioxide production, remember that the carbon dioxide, excessive carbon dioxide, it produces the stimulation of the respiratory center. There will be the stimulation of the respiratory center, and these are the vicious cycle. Like whenever you having the increase in level of carbon dioxide, obviously body need again more amount of the oxygen, isn't it? So what it will do, it will stimulate your respiratory center, and due to stimulation of respiratory center, it increases your breathing process. So you will take more and more breathing, and due to that the more breathing which is happened due to stimulation of respiratory center, it is called as hyperventilation. So there will be the hyperventilation in patient. This hyperventilation produces respiratory alkalosis. Now let's see what is respiratory alkalosis and what is the reason, right? So most important point here to remember is the carbon dioxide in a plasma, it is converted into the bicarbonate, isn't it? So it is converted into bicarbonate, and bicarbonate, what is the pH? The pH of the bicarbonate, it is the basic in nature, right? So the basic pH, it is also called as the alkaline pH. So it is also alkaline in nature. So there is the excessive production of the bicarbonate. So further, this excessive production of the bicarbonate, because anything which is excess, body having the mechanism to remove that excess, right? So this excess of the bicarbonate, it produces the respiratory alkalosis because the pH become basic, isn't it? Now the body it remove this excessive bicarbonate by renal mechanism. What body does? It increases the excretion of the bicarbonate. So this is the normal compensatory mechanism where wherever anything which is there in excess, it is removed by our body. Now again, up to certain extent, body will remove this bicarbonate. If this limit it is crossed, then body will unable to remove excess of the bicarbonate and the patient will suffer from respiratory alkalosis. So this is not an advisable, this is again not a normal condition, but this may produces the complication in those patients, right? So the larger doses, due to this, it causes depression of the respiratory center, leads eventually to retention of carbon dioxide. So there will be the excessive retention of the carbon dioxide, and thus it increases the plasma carbon dioxide level. So again, due to increase in excessive plasma carbon dioxide level, carbonate, it produces also the systemic alkalosis. So there is not just respiratory alkalosis, but also there is systemic alkalosis. So the pH it is changing from alkaline to the acidic, right? In addition to that, it doesn't stop here. It also produces another problem which is related to the pH, which is called as metabolic acidosis. Now why it produces metabolic acidosis? Because aspirin after metabolism, it is converted into different acid. So it results from accumulation of the metabolite of the aspirin, such as pyruvic acid, lactic acid and acetoacetic acid. So all these are acid. And what is the pH of the acid? The pH of the acid, it is acidic in nature, so having the low pH, and due to this low pH it will produces the metabolic acidosis, because you want the pH in the blood from 7.2 to 7.4. So 7.4 it is normal pH of the blood. It is towards not much acidic, more alkaline. It is generally the neutral in nature and little bit towards the alkaline pH, isn't it? So since there is increase in metabolism of this aspirin, like pyruvic acid, lactic acid and acetoacetic acid, right, it produces metabolic acidosis. In addition, this acid load, it is also associated with the salicylate. So what is the salicylate? So aspirin converted into its metabolites called as salicylate. So all these metabolites are acidic in nature and they contribute to the metabolic acidosis which is associated with the aspirin, right? So what happened at the high dose? So the effect of the high dose on the central nervous system is it produces the stimulation with the excitement. It also produces after the excitement it produces the coma and respiratory depression, and maybe the last stage could be the death of the patient. So the first on the CNS it produces the stimulation with excitement and eventually it produces the coma and respiratory depression which may lead to the death of the patient. Since this is very severe, the salicylate poisoning, it constitutes a medical emergency. This is not something the routine problem, or this cannot be treated at the home. This could be a medical emergency at excessive dose of the aspirin. So that is not at all advisable. It produces severe metabolic acidosis and respiratory alkalosis, and we have seen the mechanism behind respiratory alkalosis as well as metabolic acidosis, right? Let's quickly see about the drug interaction of the aspirin, and then I think we'll stop. And paracetamol, in the interest of the time, since now it is almost 11:30, your time is over and you have to attend next lecture. So in interest of time, I will skip paracetamol part, and that we will study in the next lecture. Okay. So before that, I will finish the interaction. So the aspirin is causes potentially hazardous increase in effect of the warfarin. So what it does, both aspirin and warfarin, they are having high protein binding, isn't it? Warfarin, the protein binding, it is almost 99%. So almost 99% of warfarin, it's bind to the plasma protein. What it means, if 99% bind to the plasma protein, it means anticoagulant action of the warfarin, it is just due to 1%, right? So the anticoagulant action, it is just due to the 1% of the warfarin. Now along with the warfarin, aspirin will displace warfarin from the plasma protein, and instead of 1%, it's depend on the percentage of the displacement. Suppose there is 20% displacement of the warfarin, then it will increase the level by 21%, because 1% it is the regularly free the drug which is available in the plasma. Since aspirin displaces 20% of warfarin, now you can imagine the 1% of the warfarin it produces anticoagulant action. So their anticoagulant action, it will be increased by 21%, right? Which may contribute to the toxicity of the warfarin. And what is the toxicity of the warfarin? When it increases their anticoagulant action, it produces especially the disease called as the hemorrhage, right? So the patient will suffer from the hemorrhage, that is severe loss of the blood, or there could be the bleeding. So the aspirin along with the warfarin, it is life threatening sometimes and the dangerous. So it produces the life threatening drug interaction. In addition, one more drug interaction is there with aspirin. Aspirin interfere with the effect of uricosuric agent. Now what are the uricosuric agents? So the uricosuric agents are the agent which are given in for the treatment of excessive level of uric acid, right? And the disease due to excessive level of the uric acid, it is called as the gout, right? So in case of treatment with the gout, you are giving uricosuric agent to enhance the excessive level, to enhance the excretion of excessive level of the uric acid. Because when there is more secretion of the uric acid accumulate into your joint and it produces inflammatory condition called as the gout. So the gout, it is due to excessive level of the uric acid. So you are giving uricosuric agent. So uricosuric agent, these are the agent which increases the excretion of the uric acid. So that much you must remember, they produces the excretion of uric acid, and this drug will see in a detail in the chapter of the gout, pharmacotherapy of gout. So there we will see. So uricosuric agent, they produces the excretion of the uric acid. Now what these drugs are doing, when you give the aspirin, it interferes with the action of uricosuric agent. It means it does not allow these agents to increase their excretion. As a result of that, it reduces the urate excretion. So inadvertently, if physician has prescribed aspirin with probenecid or sulfenpyrazone, which are uricosuric agent, then remember that it will reduces the urate excretion. Now if urate excretion it is reduced, again uric acid will start accumulating into the joint and produces the inflammatory condition, or it produces the worsening of inflammatory condition when aspirins are given along with uricosuric agent, right? So it should not be given especially in case of patients who are on treatment with the gout, where there is increase in the level of the uric acid. So this is all about the aspirin. So I have done with my today's session.